Good evening and welcome to another episode of the Medi Show. I am your host Mumbi Mavuti, and today we are going to be talking about infertility, a matter that is affecting a significant number of our population. But is it getting the attention that it deserves? I don't think so. But right here in studio, I have Dr. Kelvin, who is going to be taking us through this topic. Thank you so much for making time for us.
Thank you for having me.
Yes, are you well?
Yeah, I'm okay.
Yeah, kindly just take a moment and introduce yourself to our viewers.
All right.
Yeah.
Hello, everyone. Good afternoon. My name is KELVIN RUKUNGU. I work at Equity AFIA KARATINA and Nyeri branches. Yeah, and thank you so much, Alice, for having me in this show. And I'm hopeful that it will be a productive, we'll have productive messages to our viewers and to those maybe going through whatever we are going to discuss.
Yeah, thank you so much also for taking your time to come and educate us about infertility, a matter that is affecting both male and female.
Sure.
But I think females are getting more attention from this more than the male. But even before we get to that, kindly tell us, what is infertility?
So basically we define infertility as inability to conceive for more than for 12 months while having sexual intercourse with a frequency of 2 to 3 times in a week, the frequency of 2 to 3 times in a week, without use of any form of contraception. Yeah.
Is this a condition or a disease that maybe is genetic or someone is born with, or is it possible that it comes through other associated factors or maybe with age?
No, infertility is not genetic. In some way it can be, in other ways, mostly it's because of other factors. Someone is not born infertile, but there are conditions that you can be born with that may lead to you being infertile. Yes.
Is it possible to have people who have already had a child, maybe one child or two, and then later they become infertile? Because most of us relate to people who have never had any child as infertile.
Yes, it's possible, and that is where we come to the different types of infertility, because we have the primary infertility and the secondary infertility. Where in the primary infertility, it's where someone has never conceived. And then in the secondary infertility, someone has conceived before, has had a pregnancy before, regardless of the outcome. They have been pregnant before, regardless of the outcome, and now they are unable to conceive again. Yeah, now that is where we classify both of them, the primary and secondary infertilities. Yes. And
what are some of the things that we need to watch out for? What is something that could signal someone back at home that they could be infertile? What are the signs and symptoms of infertility? Because I think most of the people in our community, they'll keep trying and they might never even seek medical assistance. What is it that they should watch out for that is going to raise alarm that you could be infertile?
Sure. I think the answer comes from the definition of the infertility. The main alarm to knowing that you're infertile is having going through sexual intercourse for about 12 months without the use of any contraceptions. So you're not using any form of contraception, either the medications or the ones that most ladies use, and you have not conceived in that period of time of 12 months. You have not conceived. So that's the biggest alarm one should look out for. Yeah, because when you notice that, you're supposed to know that there's a problem and at least seek medical attention. Yes.
Any other thing, because you've mentioned that this is going to prolong to up to 12 months, and then you'll be prepared to maybe go find medical assistance. But within this period of time, is there something else that could be happening, let's say in a female body, that could alert them that that is going to make them get concerned about this?
For sure, there's no much one things that can make you know that you're infertile.
Mm-hmm.
I think not conceiving is the biggest alarm for
mm-hmm.
knowing that you're infertile.
Mm-hmm.
In as much as you might have conditions, other medical conditions that may arise within this period we are talking about, that the period we are talking about where you are trying to conceive, and then you have other medical conditions that maybe the doctor may tell you now, these conditions might lead you to being infertile, or you might not be able to conceive while having this other condition. Yes.
And what you mentioned that for people, especially the ones with secondary infertility,
yes,
that it is going to come as a result of other factors. What are some of these factors that could contribute to one becoming infertile for, let's start with women?
Yeah. Mm-hmm. So there are many factors that are classified differently that may lead to infertility. And one of the causes is infections. As we all know, most sexually transmitted infections. Infections like gonorrhea, those are infections that may lead to infections of the pelvis. Infections we refer to as the pelvic inflammatory diseases. Those are conditions affecting the reproductive organs. So those are one of the causes that, and the major causes of the infertility, mostly in women. And then we have, among those conditions, we have conditions like fibroids, uterine fibroids, conditions like endometriosis. Yeah, those are some of the major causes of the infertility in women. And then we have conditions affecting the fallopian tubes. So the fallopian tubes is one of the main organs, reproductive organs of the female reproductive system. So mostly we have cases where the fallopian tubes are blocked. So when they are blocked, they prevent the egg that is produced in the ovaries from traveling to the uterus. So that is another condition that might cause infertility. But those are some conditions like that can be treated. And also conditions like we are talking about the conditions of the fallopian tube. They can be caused by maybe a previous pelvic surgery. Maybe someone underwent a pelvic surgery before, of maybe not related to the infertility, but now maybe in the process maybe of the surgery there was damage maybe to the fallopian tubes. Another thing is we have hormonal imbalances or hormonal conditions where maybe there are hormones that that are responsible for pregnancies. So the hormones might be either the hormones can be produced in a low rate or overproduced. So yeah, we have the hormones like luteinizing hormone, follicle stimulating hormones. Those are hormones that may be crucial when there's a problem with the production of the hormones. They may cause infertility. Other causes of infertility in women are problems with the ovaries. The ovaries might be having a problem where the ovaries are not producing the egg, because the egg has to be produced so that it can be fertilized by the sperm. So we can have a condition where the ovaries are not producing the eggs. So you'll definitely not have any fertilization going on, and hence no pregnancy. Yes.
So you've mentioned a few conditions that could result to infertility.
Yes.
I want to believe if left untreated.
Yeah.
So like for endometriosis, what is it? Because someone could hear that a condition like endometriosis could lead them to being infertile, but they don't understand what is endometriosis.
So endometriosis is when there's tissues that are similar to the ovarian lining. No, not the ovarian lining, the uterine lining. They are similar but not the same, that grow outside the uterus. So they may resemble the uterine lining, but they are different. So they grow outside the uterus, and it usually manifests in a woman, maybe from the moment they start experiencing their menses. And it's usually a condition that women experience a lot of pain, pelvic pain. Through surgery or through medications. Yeah, so it's one of the major causes, major conditions that lead to infertility in women.
You've also talked about fibroids.
Yes.
What is fibroids, and is it affecting all women across all ages? It comes with age. Is age a factor in fibroids?
No. For fibroids, it's not age related, but mostly it affects women of childbearing age. So fibroids are non-cancerous tissues that grow inside the uterus. There are different types of fibroids, but it doesn't necessarily mean that whenever someone has fibroids, they are infertile, because there are many classes of fibroids and the severity of fibroids. You can have someone who has the severe most case of fibroids, where they maybe require surgery to remove them. Some fibroids we just manage supportively. We don't have to go into medications or surgery. Yeah.
So that is it about what could cause infertility in women. But I'm wondering, what about this person who has never had any child and they were just infertile? Is there a specific cause for that?
There's no specific cause of primary infertility, the one we are talking about, where a woman maybe has never conceived before. There's no specific cause, but all these causes we've talked about are among the causes that may either cause the primary or the secondary infertility. There's no specific cause for primary or, yeah.
And for women who are suffering from infertility, do they receive their menses?
Yes, they will receive their menses as usual. Yes, so because infertility, it's not affecting the menstrual cycle. Yeah, they receive their menses as usual, but now there are other factors that come in that cause the infertility. Yeah.
Thank you so much for that. Now that was about women.
Yeah.
What is going to raise alarm for infertility in men?
So there are factors that are there in men and are also there in women. So one of those factors is the blockage of the reproductive tract, because you know, there's the path that the sperms follow from when they are released from the testes to when they are ejaculated, and now they are into a woman's reproductive system. So whenever you have the blockage, so the sperms will not be able to reach the woman. Yes, and one of the causes of the blockage of the reproductive tract is maybe injury, because you know, injury may be through sports or just accidents. One can be injured, maybe untreated infections that are left untreated for long can cause the blockage of the reproductive tract in males. And also something else that may cause is the hormonal factor. We've talked about the hormonal factor in women. We are also here talking about the hormonal factor in males. It happens. It's usually the testosterone. It's the hormone that is responsible for the growth of male reproductive organs. You know, when a boy is becoming a man, there are things that develop slowly, maybe like something like pubic hair that show you that there's this boy is turning into a man. So the testosterone is the one that is responsible for all that. Yes, and also we have other hormones like the follicle stimulating hormone and also the luteinizing hormone that are released in the brain by a gland called the pituitary gland. So if they are released in high numbers or in low numbers, it can also be a cause of infertility. Yes.
And I don't know if this is a myth or it is actually proven. You're going to help us with that. But mostly people are advised, men, or we hear out there in the community that alcohol and abuse of other drugs is going to cause infertility in men.
Yes.
Is that actually a factor?
It is true, and it's not only in men. It also happens in women. Longer use of these drugs, mostly alcohol and tobacco use, which are mostly available, readily available, causes one of the major causes of infertility in both male and females. Yes, and also exposure to toxins. Maybe those people who work in factories where there's production of toxins like lead, they may lead to infertility. Now the secondary infertility or the primary infertility. Yes.
And obesity, is obesity is it going to contribute to infertility in any way?
Yes. Obesity, it's usually not just obesity. It's either obesity or low weight, because when someone has a lot of weight, now the obesity we are talking about, it's also one of the causes of infertility. And also for people with, especially women with few kgs, a few weight, it also can lead to infertility. Yes.
Thank you so much. I think that is quite a breakdown of what could cause infertility. And from what you said in the introduction, that infertility is when someone is having unprotected sex for 12 months.
Yes.
And they're not getting pregnant. It sounded like someone can diagnose themselves that they're not infertile. But is that the case, or are there other tests that are done to confirm whether one is fertile or infertile?
Yes. There are many tests that can be done. You can do lab tests are done, imaging tests are done. Yes, and also for the lab tests, you have to check for the hormones. For males, you check for the semen is analyzed. Yeah.
That is the only test that is going to be done to check whether someone is infertile.
No. As I said, there are lab tests where maybe blood will be taken and the blood will be used to check for the level of the hormones. The hormones that we mentioned before, the testosterone in male, and also the follicle stimulating hormone and the luteinizing hormone, that is both in male and female. And then there are other things like the semen analysis in men. The semen is analyzed for the quantity and quality. Yes.
So we've also heard of other conditions that will lead maybe for our women maybe to surgeries that will lead to removal of their uterus. Now, is that also going to be described as infertility after their uterus has been removed?
I wouldn't call it infertility because these people are not trying to get pregnant because it's a condition that has led to the removal of the uterus. So these people will they'll be infertile, but because there's a cause. Yes, there's a cause.
It's related to another condition.
Yes. Yeah.
Then there is this question that I'm sure a lot of people are waiting for. Use of contraceptions, especially in women. You hear out there in the village, alikosa mtoto sababu alianza kutumia contraceptives mapema. Is that true? Can contraceptives lead to one being infertile?
No. Longer use of contraception is not related to infertility. Yes, and people use contraceptives for various reasons. So it has not been proven that it causes infertility. Yes, it's just stops the infertility. It pauses the infertility, the fertility of a woman, because she's trying not to get pregnant. So she's basically fertile, but she's just stopping the process of conceiving. Yes.
I think most of them say in this manner that someone maybe started using contraceptives before they have a child, even one, and maybe later on when they're trying to conceive, they don't conceive, and the community, or let me say for lack of knowledge, people attribute that to use of contraceptions. Is it in any way contributing to one becoming infertile? If maybe someone started using contraceptives when they are in high school, if they become sexually active early in age, is it going to contribute to them being infertile maybe later in life?
No. The use of contraceptives for whatever period has not been associated with infertility. It's basically other factors that lead to infertility. Contraceptive use is not related to infertility. Yes.
So that is a myth. Here we learn and unlearn at the same time.
Sure.
So another myth, or I don't know, community knowledge that has been associated with infertility is witchcraft and other family matters. I don't know, does that also does it make any sense medically, for lack of a better word for it?
So I, for once, do not believe in witchcraft. So I wouldn't associate witchcraft with infertility. So if people out there talk about the infertility being caused by witchcraft, I think that's a special group that believes in witchcraft. But witchcraft and medicine, they are not together. So we've mentioned the main and the most common causes of infertility, and witchcraft is not among them. Yes.
So someone should not sit back at home and not seek medical help because of myths like those ones we've broken down. And thank you so much for enlightening all of us regarding that. So we're going to be taking a quick break here at Medicamp. Stay tuned. We are going to be back shortly. Thank you.
GTN TV, the home of gifts and talents, presents you with an opportunity to advertise your businesses, death and funeral announcements, wedding and dowry ceremonies, announcements for government meetings and those of other registered groups or organizations, and many more at affordable prices. For more information, you can visit our offices at GCTC Complex, former Othaya Teachers College, or call us on 0742 606 195 or 0721 706 504 or 0768 411 708. You can also send us an email via sales@gtntv.co.ke. GTN TV, the home of gifts and talents.
Sharia hado ugithomera gukunya gita, piano kana migambo niyo vocals. Rehoboth School of Music maheyanaga mathomo ma kirathi kia iguru muno. Macerere Nyeri Town haria opposite Naiva Supermarket, kana waranirie nao kuhetukira namba cio cia thimu 0715 031 506. Rehoboth School of Music, cama wa rwimbo ni inanda.
Welcome back, and thank you so much for staying tuned. We are talking about infertility. We have just broken down some of the myths that are not actual causes of infertility, but back in the community, we have learned to look at them like they are actual causes of infertility. And Dr. Kelvin has been educating us on what are the actual causes of infertility. Before we move on from the myths and the misconceptions out there in the community, what about abortion? It has also been associated with infertility. Someone gets married, they're not getting children, and the community will look at that woman like maybe they aborted when they were young, and that is why they're not getting children. Is that an actual cause of infertility?
Abortions is not an actual cause of infertility unless it's the unsafe ones, because there's safe abortions and the unsafe abortions. But maybe repeated cases of unsafe abortions might lead to maybe someone becoming infertile. But it's not proven that abortions cause infertility. It's the unsafe ones, because what is happening nowadays is people are just aborting. They're not, as much as it's not legalized, people are not using the right procedures when it comes to. So the unsafe abortions may be repeated a lot, maybe can cause the infertility. Yes.
That is something to maybe look out for. It's a warning. But before we move on away from that, I want to talk about the stigma associated with infertility. Mostly for men, don't even know if they are comfortable seeking medical help with infertility. But for women who cannot bear children in our community, they are really stigmatized. What do you think is the cause for this? Do you think it is related to some of these myths that we are talking about, that someone will not think there is the real the medical cause of abortion that you're talking to us about, and they're going to focus on the myths that you're just helping us break down? Is it related to the stigma that women are facing?
So I think what people should know out there is infertility, people do not bring themselves to become infertile. I think from the causes that we have just mentioned, there are many causes of infertility, so it can be anything that is causing the infertility. And unless you check with your medical practitioner to know what is causing you not to conceive, I think also people should learn to know that, they should know that it's not someone's fault to become infertile, because from what we've just mentioned, many of the factors that lead to infertility are unpreventable. As much as there are other factors that can be prevented and that people can avoid, so that to prevent themselves from becoming infertile, maybe like the use of drugs, untreated infections that cause their infertility. But people out there should know that infertility is something that can be managed. If it's not that severe, it can be managed. And people should not stigmatize someone because they are infertile and without knowing what is the real cause of the infertility. Yes.
Thank you so much for that. And are people coming to the clinic seeking medical attention on the same, on infertility, and what are the rates in our country maybe, or in our region? Are men suffering from infertility more than women?
So a third of men, of most of the cases of infertility are related to men, where the other number is maybe with women. But people are really coming out because I think we are entering into the digital world. We've entered into the digital world. People are learning maybe from this kind of shows, from the internet, and we have clinics that are majorly for infertility maybe. People have put up those clinics where they deal with infertility. So I think most people are coming out to check on their worries about not conceiving, and it's not something that people should be afraid of. Whenever someone notices something is not going well, I think they should seek medical attention. And no medical practitioner is going to maybe laugh or criticize you for being infertile. It's a condition just like any other. It can be treated if the cause of the infertility is maybe treated, can be treated. Yeah.
Thank you so much for that, because for most of these conditions, they can't be treated. So when you're talking about infertility, what interventions as medical practitioners do you take when someone presents with a case of infertility? And are they different for men and women?
Yeah, they can be different. Now, the management will basically involve the cause. And just like any other condition, medical condition, the management starts from the history and examination. So you take a detailed history about the patient, you know about their, for women, you have to know about their menstrual cycles, how they've been, the age of their menarche. Menarche is the age where a woman started receiving her periods. So you start with the history taking. You need to know more about the patient. You need to know what they do on a daily basis. Now that's their profession, because they are professions that, as I said, people who are exposed to toxins that may lead to infertility. You need to check that, because you cannot just assume. You also have to do examinations, maybe to rule out the pelvic inflammatory diseases. And now we go to the testing now. It's either the imaging, or you can do the imaging, you can do the lab tests. Yeah, and also for women there is something called monitoring if the ovulation has happened, because for pregnancy to occur there are three main things that happen. We have the ovulation. Ovulation is basically the release where the ovaries release the eggs. So that is one of the main factors for pregnancy to occur. We have ovulation, and now we have fertilization. Fertilization is when now the sperm and the female egg meet, and now fertilization takes place, and then the end process is the implantation. What they form is called a zygote. When the egg and the sperms come together, they form a zygote. Now the zygote is attached or implanted to the uterine cavity. So for the ovulation, we monitor. It can be monitored by various ways. You have to check about the history of the menstrual cycle of a woman, and also you have to. There's something called the basal body temperature monitoring. It's a body temperature that is taken by a woman every morning, maybe before she gets out of bed. It's called the basal body temperatures, and it's high during ovulation. So if it's high, it shows that ovulation has happened. So at least now we can look at other factors that may be causing the infertility in a woman. Other things that can be checked are the semen analysis, as we talked. The semen analysis, the semen is the sperms are taken, they are analyzed, and we analyze the sperms for many factors, because we have to check for the volume of the sperms, because you might be producing the sperms, but are they enough to meet an egg and maybe fertilize an egg. The other thing that is checked in sperms is the quantity, because you've heard when men are told they have a low sperm count. It's one of the things that are checked in the semen analysis. So you check if the sperm count is enough, because if the sperm count is not enough, we usually say more than 15 million sperms are normal sperm count, more than 15 million, but less, one may be unable to make a pregnancy. Yes.
And so there are a lot of technologies that have come up to help infertile couples that could help them with getting a child if it is beyond what you're saying, if it is beyond maybe something that can be controlled or managed, and they're able to get a child. So what options do we have for infertile couples that still wish to become parents?
Yes. So we have many ways people are getting pregnant, because in developed countries we have situations where sperms are harvested from the man and the eggs are harvested from the woman, and there's both the sperms and the eggs are taken to the lab, and where the fertilization of the egg happens in the lab. So when fertilization happens, then whatever is formed now, the zygote, is transferred directly into the woman's uterus. Yes.
And is that available in our country?
Yes, it is happening, but in these developed hospitals. Yes.
So it is not very readily available for most of maybe people who are suffering from this condition in our country. And even if it is available, the cost, how much does it cost in our country? Like if someone comes to your hospital and they require such an intervention, would you say it's expensive for most people?
So I don't have the figures for the for such a procedure. But maybe we have fertility clinics. Maybe those clinics can help. But for such procedures, we are not doing it ourselves, even in Equity AFIA. But what we'll do is we have specialists, gynecology specialists, who will help someone in the process of becoming fertile or conceiving. Yes.
So before we move on from treatment and talk about whether it is preventable, is it possible to have people who cannot, especially men, who cannot totally produce sperm? We talked about sperm count. Is it possible to have people who do not produce any?
Yes. The sperms are produced by the testes. So there we might have conditions where the testes fail to produce the sperms. So it's either the sperms are producing the sperms are being produced by the testes, or the testes are not producing any sperms at all. Yes.
And is that also applicable in women, that they don't produce the egg?
Yes. The ovaries that produce the egg in female can also have a problem. We have conditions that may affect the production of the eggs in females. Yes.
And that is going to be something that you're born like that, or it's also associated to the factors that we talked about?
Mostly it's the factors that we've talked about, but some of the things are irreversible. Maybe you can use medications to stimulate, especially the ovaries. We can use medications that stimulate the production of those eggs.
So can we prevent infertility?
Yes. As long as someone has been fertile before and maybe has gone through a pregnancy, there are things we can do to prevent the infertilities. We've talked about the infections. They are very common, sexually transmitted infections. These are conditions that may cause infertility, if untreated for long. So I think whenever someone has such kind of conditions, it's good to seek medical attention so that you can manage the infections that may lead to infertility, and also preventing yourself. Yes.
Is it all the STIs that can cause infertility?
No, not all. Yes. Mostly it's we have things like gonorrhea that may cause what we talked about, the pelvic inflammatory diseases. So the pelvic inflammatory diseases are the diseases that affect the reproductive system. If one organ of the reproductive system is affected, it will lead to someone not being able to conceive.
If we prevent STIs, maybe we have a hand at preventing infertility. Are there other preventive measures that people can take to to prevent them from getting to a point where they're infertile?
Yes, we talked even about the unsafe abortions. I think one should not consider the abortions because there are many people who go through a lot of abortions. We need to blame them for doing that, but if you go through a lot of them, they may cause them secondary infertility. But most of these conditions we talked about, maybe something like endometriosis, something like fibroids. Some of those things are you cannot prevent, but something like endometriosis you cannot prevent. But for something like fibroids, there are things you can do to prevent you from having the fibroids. Usually say that the fibroids occur when now the womb is empty, the uterus is empty. But if you were to have to prevent the fibroids, we have to check about things like the weight. We talked about obesity, which is a key factor. It is a key factor in infertility. So people have to exercise, diet. Yeah, those are some of the things, and also avoid things we talked about, even smoking, use of alcohol. If those are the things we said can cause infertility. So I think if you avoid such kind of things, you are at a higher hand of not being infertile. Yes.
We've talked about the STDs and some other conditions that are only present in women that lead to infertility. But how do we prevent some of the conditions that are going to be in men that will lead to infertility?
Yes. So I think for the infections, they are affecting both the male and female. So infections of that affect the urinary tract. If also in male, if they go untreated for long, I think they can also cause the infertility. Maybe something can be done to prevent the progress of the infertility or reverse the infertility. Yes.
So before we move on from how to prevent infertility, you realize that most people out there in the community, when a couple is infertile, it's immediately going to be assumed it is the woman. Now, are men to be specific, are they specifically coming to the hospitals to get checked if they are a couple that is struggling with infertility? Because I feel like a lot of men have not been sensitized about infertility.
Yeah, it is true that not only men, but most people have not been sensitized about the infertility. But usually when we are managing infertility, we usually advise for both, for the couple, not just one person, because until proven, you cannot point a finger and say it's a man's who is not fertile. So that is why we advocate for both the man and the wife to come to the clinic together, so that we can do the testing for both of them. We can do imaging for both of them. We can analyze everything, so that now when the problem is, we get the problem of the infertility, we get the reason why they are not conceiving, then we can be able to manage. But we cannot point fingers and say it's a man or a woman until now we've tested. Yes.
So the community as well should not point fingers.
Yeah.
They're supposed to visit a clinic. So we've mentioned that a lot of people have not been sensitized. As medical professionals, the government and the community at large, what do you feel is our role to sensitize people about this? Because I know for a fact a lot of people are struggling with infertility, but they've never stepped foot in a medical hospital trying to seek help.
Yeah.
What do you think should be done? What is the role of each and every one of us in curbing infertility?
I think the first thing people should know is that there's a point where infertility can be reversed. So one should not just sit at home and say, now that I can't bear a child, I'll just stay. I think the first step is coming to the hospital, and also getting the right people to trusting a medical practitioner to take you through the process of finding out the reason or the cause. And also the community should not point fingers at someone for being infertile. We know that in Africa, people are expected to bear children, but I think the not bearing children should not be something to stigmatize someone with. So I think the government should also sensitize people about the same. People should, the government should maybe help through maybe local stations, just like this, that infertility is not a problem. It's something that we can manage,
and deal with. But it is true, it is not getting a lot of attention, because like right now, if we were to walk in the next town right there, I will find a dental clinic, find another medical clinic and everything. But do you think that people are really actually struggling to get help with infertility, that the options of treatment are not quite readily available in our country?
Yeah, I think we are still developing in our country. So we are not yet to the point where we will have maybe many clinics about the same, because maybe people might think that managing such kind of conditions might be expensive, and with the current economic status, maybe people are afraid to approach or seek medical attention, because they might think this is maybe a permanent situation or something that may be very expensive. So maybe there's always a starting point. So if you visit maybe just any other clinic, you don't have to start at a fertility clinic. You can just start at any clinic, anywhere you find a medical practitioner. They will refer you to the right people, because we have professionals and gynecologists who can take up the matter. Yes, so you don't have to look for a fertility clinic. You just start from any medical clinic, and if you find someone who is ready to help, and then they can refer you to the next person. Yes.
As we wind up, would like to know, does infertility, does one's chances of becoming infertile increase with age?
Yes, it does, and the older you get, the more infertile the more infertile you become. So women, usually more than 40 years, their infertility decreases by almost 50%. And also, even if they are able to conceive, there is a higher risk of miscarriages. So it's advisable maybe to bear children if you are planning to be before that age. Yeah. Before
44 women.
Yes. Yeah.
And men?
For men, now it can be older, but now as they get older, their sex drive decreases. Maybe you might find the sperm count also, and sperm count and quality will also decrease. So age is very very vital in the fertility topic, because as you grow older, your fertility decreases. Yes.
Thank you so much. I think we've been learning quite a lot, and these are not matters that people are willing to openly talk about, but it is a good thing that you are assuring them that there is help out there. All one needs to do is to visit a clinic. So as we wind up, I want you to take a moment to maybe hammer on something that you've said, or maybe something that you want to inform the people about. And maybe if you want to shout out to someone, this is the opportunity to do that.
All right. So thank you once again for having me. And I'm hoping that if not all, somebody has learned something from this topic. And we can usually help even out here. We have clinics where you can come, and we'll help in that process. So basically, we've just said that infertility should not be stigmatized, and one should not stay at home thinking that it's something permanent. So one should seek medical attention, and then it's usually not something that will be done in a day. Maybe it may take a process, but you have to be patient. If you've decided now to, you're really sure you want to become pregnant, you have really to be patient, and also be ready to be helped, so that we can do the test, we can find out where the problem is. If it's reversible, and we can reverse. There's something else we also missed on the people wanting to get pregnant. There's something called surrogate mothers. I'm not sure if it happens a lot in Kenya, but surrogate mothers is where you contract someone to carry your pregnancy. So maybe if we've reached a point where a woman cannot carry a pregnancy, but maybe her eggs can be retrieved, and the husband's sperms can also be retrieved and then transferred to the surrogate mother. It's usually maybe something that may require maybe a court process. I'm not sure how it goes, but it happens where you contract someone to carry your pregnancy. Yeah, they're just a carrier, but whatever is as from the pregnancy is for the woman and the husband. And also the sperms can be from also a donor. Yeah, for maybe women who don't have someone to father their children, there are donor people who donate their sperms. Yes.
And all those are very available options. Okay, they might not be very available, but
Yes.
they're available options even in our country. And I think your take home is that infertility can be reversed, and so you don't have to sit back at home and struggle with it, thinking that you cannot get assisted. It's not a permanent situation. It can be helped. That has been Dr. Kelvin from AFIA Equity, and thank you so much for making the time for us to educate us on that.
Thank you.
Thank you so much to our viewers for taking your time to learn together. Here in Medicamp, we learn together because this is a platform where we bring in the experts to teach us about a lot of medical and health-related factors and matters that are out there, but the information is not quite available. Thank you so much, and see you on our next episode. I have been your host, Mumbi Mavuti, and always remember that your health is your wealth.